What is the coronavirus doing to our brains, and what is the pandemic doing to America's mental health? I'm Lee Kelso. This is Health Call Live Online, where we feature longer versions of interviews broadcast in our radio program, the Health Call Live Radio Hour. And for this segment, I'd like to introduce you to Kate Morgan. She is a freelance journalist published in many magazines and newspapers. You may well have read her work. I found her from an article that she published in Medium, a membership-supported website that is offering COVID coverage at no cost to you. So I'll put a link down below so you can find her work and the rest of that content. Kate, good to have you here. Thank you.
Thanks, Lee. It's good to be here.
What do I need to know about how the virus is affecting our brain?
So it's a big question, and unfortunately, at this point, it's more question than answer, and that is certainly the first thing that you and all of us really need to know about the mental and neurological aspect of the coronavirus is that we don't know yet. So there have been some early studies. We have a lot of anecdotal evidence from patients with active infections, from recovered people, and from the healthcare professionals who are treating them. We are getting more of that all the time. We also have historical evidence that we can look at from past pandemics and even from pandemics caused by coronaviruses. So that helps us get an idea of what we're looking at. But in research terms, it's important to understand that this illness is still essentially brand new. So we're really only beginning to understand the short-term implications for our mental health and the neurological symptoms. And we don't know about the long-term mental consequence that it will carry yet. But essentially what we know at this point, and what I learned through my reporting, is that there are two ways that this virus impacts the brain. So it impacts the brain physiologically and psychologically. So there's a recent study out of the University of California at San Diego that notes that we are seeing the virus physically penetrate the blood-brain barrier. What that means, in short, is that it can get into the nervous system, it can get into the spinal fluid, directly into the brain, and it causes inflammation. That inflammation can have a lot of different symptoms. They can range from really severe things like delirium and hallucinations to more minor stuff like headaches or just sleep interruption and insomnia. It's really across the board. But there are early studies from China that are suggesting that the number of people experiencing some level of neurological complication is really high. They're seeing 40% or more. And then there's the psychological impact, which is not necessarily unrelated, but essentially we're talking about things like depression, anxiety, insomnia, PTSD, and that'll make sense, right? When you think about what it's like to have the coronavirus, it's a traumatic experience. I mean, whether you're hospitalized with a severe infection or you're simply, weathering some flu-like symptoms at home, it's still something that's very scary. And in many cases, you're experiencing it alone. You're isolated. If you're hospitalized in particular, the only people that you're in contact with, like physically, are your doctors. You're not able to have your family there. And that just adds to the trauma. All the people I spoke with in the course of my reporting, they talked about both the feelings of fear and depression and isolation. And then they also talked about feeling afraid of themselves. As they begin to recover, they're all feeling like they're still contagious. They're feeling like they're a danger to others, despite the fact that, physically they're not. And that's a feeling that could take a long time to recover from.
You touched on a lot of things there, lots to unpack. So that UCSD study referring to crossing the blood-brain barrier, we're seeing the consequences being a form of encephalopathy, so a swelling of the brain,
Yes.
and we don't know what that's going to do. That kind of simulates a concussion sort of experience, and we know the concussions can affect and cause not only headaches, but also loss of memory and just general cognitive decline. So yeah, I get it. There's a lot going on here.
Correct.
Touch some more on some of the individual cases that you covered in your article and what we can learn from them.
Yes. So one of the biggest issues that the people I spoke with, all of whom happened to be women, is that they had a lot of trouble sleeping. That could be both a physiological impact and a psychological impact. And that's a big one. When we lose sleep, as you can well imagine, we have all kinds of things related to that. And that can worsen feelings of depression and anxiety. In some cases, there are some studies out there that show that a big part of relieving symptoms of depression and anxiety is physical activity. Unfortunately, one of the biggest physical symptoms of the coronavirus is that it limits our ability to perform physical activities.
Lingering effects. What are the
Mhm.
researchers telling you we might see as sort of the ongoing sequelae from this pandemic?
Yes. So the lingering aspects of this are really the most worrisome part, and I don't want to be an alarmist. And scientists by nature are not alarmist. That's not helpful. We don't want to scare anybody. But the scientists that I spoke to called this a potential secondary epidemic, and that's not hyperbolic. So we can look at historical evidence that tells us that after the 1918 influenza pandemic, there was a really significant increase in the populace in things like PTSD, depression, obsessive compulsive disorder, and even neurological conditions like schizophrenia in survivors of that illness. So again, with COVID-19, we don't know. This is simply drawing parallels between the data from historical pandemics and this one. What we do know is that things like PTSD and anxiety and depression can get worse the longer they go untreated. And there remains a stigma in this country surrounding mental health conditions and the treatment of them. So doctors don't ask and patients don't volunteer information. The result is that they don't get the help that they need, and they don't acknowledge that it's a problem, and then it gets worse and worse and worse. And that is how you get a depression epidemic in the wake of a viral one. So we are in danger of having that occur, and that is the part that we should be most worried about. The other thing is that we aren't going to know how long these neurological symptoms of COVID-19 last. In some cases, they don't even appear until 2 weeks, 4 weeks, 6 weeks after the infection has been diagnosed, and sometimes even after the physical symptoms have already begun to recede. So unfortunately, there's not a ton of information out there that we can say for sure, this will happen, this will happen, this will happen. But really, we're at risk of having people who have lingering neurological, physiological, and psychological impacts of having had this illness for a very long time.
Yeah, that is one of the odd things about this disease, isn't it? And it seems young people far more severely. I mean, they're going to be feeling, even if the disease itself is not affecting them, the loss of job security, the loss of income, derailing a career early on, the impact on family, loss of a family member should that have occurred. All of those are things that we haven't seen in any other condition. And this is so
Oh, yes.
totally out of everybody's control that adds to all that hassle, all that stress, right?
You're absolutely right, Lee, and that's a very important note. Is that the mental impact of COVID-19 of this pandemic is not just limited to people who get this virus. I think everyone is dealing with some mental ramifications. At the moment, I'm reporting a story about the impact of long-term stress and anxiety on things like working memory. So maybe you relate to this. But if you're having trouble focusing or getting tasks done, that is a symptom of long-term stress resulting from our current situation. And everybody's feeling that, regardless of whether you have a relative who has coronavirus, whether you're high risk or people you love are high risk or not, it really doesn't matter. We're all experiencing, at least a subcurrent of some pretty severe stress. So there's just a myriad of ways that affects your psyche and affects your brain. And you're right. I mean, young people are absolutely being hit really hard by this, and I think will continue to be hit very hard by this. Even those who don't contract the coronavirus, we're going to be dealing with either our own job loss or other people's job loss. We're going to be dealing with an economy that is, I mean, for me personally, my generation, I graduated college into the recession. And now I think it's pretty clear we're cruising for another one. So yeah, young people are certainly at risk, but it's not limited to young people. And I would actually argue that the stigma that we talk about surrounding mental health has a lesser impact on young people. I think older people are, generally speaking, more reluctant to discuss those symptoms. And I think that we need to be aware of that and be concerned about it.
I would agree with you completely on that one. So let's say that based on your reporting, you now have a better understanding of the unexpected consequences of this virus. If a member of your family were to become infected, because of what you know, how might you manage this differently than the rest of us?
Yeah, so I mean, it's just about awareness. It's about being aware of potential neurological symptoms, recognizing them, and treating them like physical ones. It's very important to get help with things like extreme anxiety or sleeplessness. It's just as important as addressing any other symptom. One of the scientists that I spoke with in the course of my reporting talked about Lorna Breen, who unfortunately died by suicide. She was the
Yeah,
head
an
of an
ER
emergency
doctor,
department.
right, in New York
Yep,
City. Yeah.
exactly.
Her
And
family
her
saw no
family,
symptoms, no indication that she had any
none.
kind of a problem.
Right. So she had no mental health history,
Hmm.
and they had no reason to believe that she would have suicidal thoughts or tendencies. And her family has spoken in interviews and said that they firmly believe that it was a result of her having contracted the coronavirus, that is what led to her death ultimately. And I mean, I've got to tell you, every scientist that I spoke with said, yeah, that's, I would think so too. Looking at that, as a researcher and as a doctor, that that absolutely seems like the case. So I say that I bring that up, just to kind of illustrate the potential severity that we're talking about here. We need to be, or certainly I would, in that situation, be looking at those symptoms the same way I'm looking at, whether my family member can breathe effectively,
Hmm.
and taking action, to get those symptoms treated. So most people, are recovering physically from this illness, and that's very important to remember and to repeat because, again, we really don't want to spread fear. But it's also just about being aware that the mental recovery takes time. Every single person that I spoke to was struggling weeks to months after their physical symptoms had begun to fade. And so, with my family member, with anybody else's family member, it's just important to keep checking in. You have to talk to people about how they're feeling, from the neck up. And we just need to normalize because no one asked to acquire this virus, and we would never shame them or make them feel like they couldn't talk about the symptoms they're experiencing physically. We want to know exactly what they're feeling physically. So we need to understand that mental recovery needs the same treatment, and that might happen over weeks or months or even years.
I think that's a good place to wrap it up. Kate Morgan, thank you very much. Kate is a freelance journalist. Her most recent article was published in Medium, and I will put a link to that in this post. Also, I'm sure, will be reading Kate in the science magazines, New York Times, Washington Post. Who knows where we're going to see you again in the future, but I hope we do. Thank you, Kate.
Thank you, Lee. Have a good one.